following segment is paid for by Holston Medical Group. Flu season is approaching quickly. The number of cases usually rises in the fall and then carries into the winter months. And as parents, we know how fast it can spread from one child to the next. In tonight's Health Matters by Holston Medical Group, we sit down with a pediatrician to get some tips on how to best protect our children. It's one thing we don't want our kids to share, yet every year it goes through classrooms and communities. Now is the time to be on the lookout for the flu.
A lot of them are the same as any kind of other upper respiratory virus or infection you might have, like congestion, runny nose, cough. You do tend to kind of get more fever, higher fever. Flu does come with muscle aches a lot, chills. Those can be worse as well.
Dr. Hall-Wurst says the flu can be more dangerous for children with chronic conditions like asthma and heart disease, as well as those under the age of 5. He, along with the American Academy of Pediatrics, recommends all children 6 months and older get the vaccine every year.
There's a lot of good evidence that it can severely decrease how sick you can get if you do get the flu. And especially for young children and children with chronic conditions or other medical problems, it can really make them very sick. And the vaccine can help decrease and prevent that from happening, prevent them from having to be sick enough where they're in the hospital.
Along with the vaccine, Dr. Hall-Wurst recommends washing your hands often, staying away from others who may be sick, and making sure your child is eating and sleeping well. He also says if your child does get the flu, make sure they stay hydrated and watch for worsening conditions.
If a child is having trouble breathing, that's something first and foremost where you would probably want to seek immediate attention, which would likely be at the emergency room. If children, especially younger children, are refusing to eat or drink anything, especially drinking, or if they're really not making wet diapers, that can be a sign of dehydration. You as a parent, you know your child best, and so if you think something is off, then you seek medical attention because you're probably right.
And as we get deeper into the fall season, now is the time to be getting that important flu vaccine, especially as we heard for children with chronic health conditions. To read more about the flu and protecting our children, please visit the Health Matters blog at holstonmedicalgroup.com.